All right. Hello, Dental Shadowers. Today we have a very special guest with us. We have Dr. Velayo, who's going to be talking about her shadowing in general dentistry. And before that, I'd also like to introduce Brian, who is a PDS recruiter, and he has a few things he'd like to share.
Yeah, thanks, Isabel. I just wanted to let everyone know that if you have any questions, after Dr. Velayo's presentation, specifically regarding Pacific Dental Services, or just, wanted to talk to somebody who, talks to students and, knows owner doctors and what to expect, I'm happy to set up a time. And I think at the end you can see my information. But I support our offices up and down the West Coast, Northern California, Washington, and Oregon. But if you're interested in other parts of the country, feel free to reach out. I can put you in touch with the right people.
Thank you, Brian. And I can put his contact info at the end of the stream in the chat in case anyone's interested. And now I'd like to give it to Dr. Velayo. Whenever you're ready, go ahead and take it away.
All right. Well, hey, everyone. I'm excited to be here, even though I can't see you, but welcome to our virtual shadowing. And so let's start from the beginning. I'm originally from Long Island, New York. And, I knew early on that I wanted to be a dentist. As early as sophomore year of high school, I had made the decision that I wanted to pursue dentistry. Up until then, I knew I wanted to do some sort of healthcare. I was really passionate about helping people. And it really clicked with me. We had a project in sophomore year. We had to present on a career to the class. And so part of the career day presentation included interviewing someone of that profession. And I was really shy, and I didn't, at the time I thought I wanted to be a pediatrician, but I was too embarrassed to go interview my family pediatrician. And out of convenience, it just so happened that we had dental appointments, me and my whole family, we had dental appointments planned that, during the timeline of the project. And I was like, well, I'm already going to see the dentist. The dentist was a family friend. I figured, we're going to be there for a couple hours because the whole family was going to get their checkups and cleanings. I'll kill two birds with one stone. I'll get my checkup and cleaning. And while I'm there, I'll interview the dentist. And I'm the type of person that, I just, when I planted the idea in my heart, I really just grew, and I remember giving that presentation and even preparing for the presentation, like, wow, dentistry is awesome. And I'm telling everyone how amazing dentistry is. And I was like, you know what, this is the path for me. And I remember what attracted me to dentistry. I mean, when I was shadowing my dentist, my family dentist, first of all, she is a female. And so I really do feel like, that representation matters in that sense, because I was seeing a woman, a mom, a wife, and see her run her own business and take such good care of her patients and be such an esteemed figure in her community. I was like, wow, that can be something that I want to do. But what really attracted me to dentistry beyond comparing my dentist to my pediatrician, who both were females, and role models that I really looked up to, I really loved that dentistry was super hands-on, that we worked with our hands, that we were able to, create things, right? Like, we're fixing people on the spot. We're not just writing them a prescription and hoping that they feel better. Like, someone comes in pain and we're able to fix their cavity or, do whatever procedure instantaneously, right then and there. And I loved how physical it was. And then also just, I saw the relationships that my dentist was building with her patients. And I knew that was something that I really wanted to emulate. And so sophomore year, I decided I wanted to become a dentist. And so I committed that. And I was like, I'm going to apply to every dental program out there. So I don't know if you're familiar, but in high school, there are some early admissions dental programs. Probably a little too late now because you're in college now, pre-dental, but for anyone watching who's not, but there were a couple of programs that when you're applying for college, it was like a guaranteed admission. So you were applying to college and dental school at the same time. And so I graduated salutatorian. I graduated second in my class. I thought I was like, pretty smart, I guess. And I thought, you know what, like, I'm going to get in. And I got invited to interviews, which were great for these accelerated programs, which guaranteed you admission to college and dental school. But unfortunately, I did not make it. And I was like, you know what, that's okay. I figured it was a long shot. Yeah, so I graduated and I got accepted to go to Tufts University in Boston. You know, the reason I actually chose that school, so even though I didn't get accepted to the accelerated programs, I still was pretty strategic when I was applying to colleges, because I was thinking about, you know, I wanted to make sure that I wanted to make sure that there were, you know, relationships with the undergraduate school and the dental school. And so specifically at Tufts University, they had, again, another accelerated program that you could apply to as a freshman. So you apply as a freshman in college, and, you know, if you get in, then you're going to do 3 years of undergrad and then 4 years of dental school. So your senior year of college, you would already start dental school. And so I was like, you know, I didn't get into the high school program. Let me see if I can get into these college programs. So then I was like, let me try to find these schools that had these programs. And so I love this, as an aside, I love this photo. I was a cheerleader. I was a varsity cheerleader, and I was like, wow, this is like, you know what I mean? A juxtaposition. Like, I'm always a fan of shattering perceptions. And, you know, they say cheerleaders have no brains or whatever. I was like, no, look, like there's my name on a billboard. Like I graduated top of my class and I was a varsity cheerleader. So don't let anyone tell you that you can't do it all. Cause, you know, we break stereotypes. Anyway, so we went to Tufts undergrad, and this is actually a really, really unique situation. So, or funny story looking back now. So my freshman year of college, I applied to that program, the accelerated program. And I made such great, you know, I joined the pre-dental society at my college. I made really great relationships with the admissions counselor at my college. And, you know, I was attending all the seminars that they had available at the Tufts Dental School that they had for pre-dental students. You know, they had like the dental shadower days and like, impressions programs, like, you know, and as a pre-dental, definitely start building those relationships with your dental schools now, because those admissions recruiters and those admissions counselors, like they'll know who's really interested in, like, that's what I did from day one. And so I had like great relationships, but, you know, I went from, and it's actually really funny telling the story, because I was a big fish in a small pond. So in high school, I'm from a small town on Long Island. It's called Levittown in Nassau County. It's like the first suburb, very small. My high school class graduated like 350. Again, I thought I was really smart because I graduated at the top of my class. Meanwhile, I go to this elite, you know, university, and you know, college hit me like a brick, and it was tough, you know, and I was really my first college exam, I took chemistry 1, which is like, you know, they say is the weed out classes for pre-med, and because chemistry was my favorite. I was in AP chemistry, right? And I was like, first test was like 70%. I was like, oh my God, how am I going to get into dental school? So that was a really, really big wake up call for me. And I was like, I need to learn how to study, you know, like all the pressures in college, right? Like you want to fit in, you want to make friends. I was playing a sport at the time too. I walked onto the rowing team my freshman year of college. And so just like trying to balance everything. Anyway, so that's just a little bit of background. And so I applied for I applied freshman year, I applied for the dental program, and I didn't get in because my GPA wasn't good enough, right? I ended up pulling off like a B or something, B- or B in chemistry. And, you know, like you need to have an A in, because they're only selecting like 1 or 2 students if they're qualified enough to go into the accelerated program. But I had such great relationships with the counselors and the admissions, and they were like, you know what, like we see like we see the potential in you, and you know what, you inspired us that we're going to go ahead and make a different early accelerated program that you can apply to your sophomore year. Instead of through a 7-year program, it would just be a traditional 4 years of undergrad and 4 years of dental school. So it was basically a guaranteed admission program. So you apply your sophomore year, and it's just saying, you know, we're going to reserve a spot for you at the dental school. if you can maintain this GPA, blah, 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 blah. I'm like, all right, cool. Let's try again sophomore year. Sophomore year, I took bio, intro bio, pre-med bio. And my class, my roommate, she is a genius. And she took bio the year before, and she was like, she was giving me advice on how to pass the class, right? And she was like, you don't have to go to class, just watch the lectures online, like, you'll get an A, no problem. And I'm like, okay, cool. So sophomore year, and again, like, I learned the hard way. I ended up getting like a B- again, bio. And I'm like, oh my God, I'm not going to make it into this program. And at one point, I think I got like C's, like I failed an exam. I pulled it together, I passed, but that was a really hard lesson for me because I had to realize my own study style, right? Like my friend, she has like a photographic memory. She, her background and just the way that she studied was completely different than the way I needed to study, right? I really benefited from group study. I really benefited from, attending office hours and stuff like that. And so again, like I learned the hard way, but eventually I figured it out. Anyway, so I applied to the program my sophomore year for the 4+4, the guaranteed admission dental program. Didn't get in. And I was like, man, I suck at this. But luckily I didn't get discouraged. You know what I mean? Of course, and every time I got a rejection, of course you're going to feel upset. And of course, like I said, I even said out loud, like I suck, right? It's natural to feel those feelings of frustration, disappointed. But you know what? After I have my 5-minute pity party, what do they say? You have 5 minutes to be emotional and then you have to be a gangster. Like, that's how I feel, life moves on. So what's your next plan? And I was like, you know what? And looking back, I'm so thankful for every rejection because I wasn't ready, right? I told you, I wasn't proving to admissions that I was ready for dental school because I didn't know how to study. I wasn't proving that I was mature enough to handle everything that I was doing because I really prided myself on being a well-rounded candidate. As I showed you, like I played sports, I did clubs. I also want to pursue this academic doctorate degree, and so I didn't really, I had to figure it out on how to balance it myself. And so it just made me work harder, and it made me realize I shouldn't take anything for granted, right? Like looking back, I'm sure if I got the early admissions that I might have just coasted. Actually, because that did end up happening. I remember, we'll flash forward. So anyway, so everything always happens for a reason. And so every rejection, just use it to fuel your fire. And it just makes you question, like, how bad do you really want it? And I never gave up because I knew my goal is I really want to be a dentist. And so I applied regular cycle my junior year of undergrad, right? So, if you want to go straight from undergrad to dental school, meaning you don't want to take a gap year, you apply your junior year. And so I took my DAT, I took a DAT prep course. And yeah, I just studied. And my junior year of college as well, that's when I took organic chemistry. And I knew that I was running out of chances, right? I already applied to dental school 3 times, didn't get in. And I was like, I'm running out of chances. I really need to buckle down. And that required a lot of sacrifices, right? And I was working, my study buddy, who is also a genius, and he wanted to go to medical school. And he was just like, Bianca, how bad do you want this? And I was like, really bad. And he was like, well, then you're going to need to make sacrifices. And I really appreciated that pep talk because, again, I feel like I from the beginning, I told you that I'm a fan of showing that you can have it all, but it's important that you need to prioritize, right? Like you need to know what is your ultimate goal. And I think that especially now, right? Like I feel like everyone's trying to be a jack of all trades and you end up being a master of none. And so for me, like the ultimate goal was becoming a dentist, and I really need to stay true to that path, even though there are distractions along the way, right? And especially nowadays, right? People want to be an Instagram influencer. People want to be a mogul or an entrepreneur over here, but it's like, what is your main goal, right? And so I had to sacrifice. So that meant I had to not go to some parties. That meant I had to, stop, no vacation, no vacation, not seeing my friends and family. I had to miss out on family functions because I had to study. And it paid off because then I was offered I got my dental school interviews. So when you apply for dental, you take your DAT and you apply for dental school in the summer between your junior and senior year, and then you get asked for interviews that fall. And if you, and the first rounds of admissions is going to go out December, first week of December. So I remember it's like a really golden day because everyone's like December 2nd, you're like, did you get accepted to dental school? And I was so thankful. I got the email that I got accepted to dental school December 2nd. So, it was beautiful. It was beautiful. And it was so reassuring because I graduated in 2011, Tufts undergrad. I majored in biopsychology, which I loved because I love psychology. And by doing the biopsychology major, I was able to fulfill a lot of my pre-med requirements, but then also pursue something that was really interesting to me, which was psychology. And it was just so amazing. And you can see on this banner, I'm Filipino, I'm first generation Filipino. So my family is really big on these banners. I have it made in the Philippines. You can see it spans 2 cars long. It says, accepted to Tufts University School of Dental Medicine. So it was so cool to know when I graduated college that I had a place to go. And so that was a really, really proud moment. And, you know, so then I go to Tufts Dental School. So after I graduated undergrad, which is in the suburban like campus, then the dental school is in the city heart of Boston, and that was a really hard 4 years as well. And you just learn, you know, all the study skills that I learned in undergrad, I was able to apply and really kick it up a notch because like they just, you know, there are times that you have 10 exams in 5 days and you're like, how am I going to study for all of this? And you just learn to be a really good studier. And this was wonderful. So again, here we are. And I made it 4 years later, I graduated. And when I was in dental school, my, sophomore and junior year of dental school, I was exposed to ASDA. So ASDA is called the American Student Dental Association. If you've ever heard of the ADA, which is the American Dental Association, you probably see its stamp on toothpaste and toothbrushes, right? The ADA, the American Dental Association, its student body governance is called ASDA. And so ASDA is basically a dental student club where all the dental students, you know, we all, join and we learn about dentistry and just you know, advocate for better better rights and outcomes for our patients and our profession, and just really work with the ADA, which is just really cool. Anyway, but the best thing I liked about ASDA was just like the networking aspect of it. And so I highly encourage everyone to get involved in their ASDA chapter because you get to meet people from all over the country, not just your own dental school. So I joined ASDA and I went to a leadership conference sponsored by ASDA in Chicago. And at that, it was great. I met and networked with hundreds of dental students across the country. And it was beautiful. And it was nice to see everyone else's experiences and just know what else is out there, right? And at the ASDA event, that's when I first met doctors and recruiters from Pacific Dental Services. And so Pacific Dental Services is a dental management group or dental support organization. And they have over 800 offices nationwide, and they help doctors achieve their dream of practice ownership. And I was just so attracted to Pacific Dental Services because I was talking to the doctors and they were giving presentations of what their practices were like. And they had these gorgeous modern dental practices. And you know, all the doctors were really young, and you know, I loved just the technology that they had, which we'll get to in a minute. And you know, for me, being the first person in my family to become a dentist, I didn't really have connections. Yes, I had my family friend who was a dentist back in New York, but you know, she has her own family, and like I sort of wanted to start my own path. And so I just felt like this could have been a really good fit. And so my junior year, after I learned about Pacific Dental Services, I made sure that I was in touch with recruiters like Brian, and I made sure I stayed in touch with the doctors that I had met over there and maintained a relationship because I just wanted to learn more. And my senior year of dental school, I after talking with recruiters and talking about like what my goals and what my visions and what I was looking for in my career when I graduated dental school, they were able to pair me up with some doctors who they thought would be a good fit with me and my personality and my goals in the areas that I was looking to practice. And so my senior year of dental school, I went out to go meet with some of these doctors and shadow. And so my best advice, I mean, and it's so great that you're doing this, is like my best advice, it's never too early to start networking. It's never too early to start making those relationships with doctors or recruiters, or just shadow and familiarize yourself with all the different ways to practice. Because different doctors have different practice philosophies, there's no two offices that are the same, and there are no two doctors that are the same. And you need to think about what is your, work style, your coaching style, what your vision for what your future is going to be, and the type of dentistry that you want to do. And then you're going to try to find someone who envisions that and embodies that. And the only way that you're going to figure out what type of dentistry you want to do, or what type of dentist you want to become, or what type of environment you want to work in, is by exposing yourself, right? And so I was really thankful with all my shadowing experience. And when I finally went to go interview and meet with some doctors, I was able to see who was a good fit. And my senior year of dental school in December, this is when all the story gets really good. I went to go shadow, and I with this one doctor, and it was vibes. Like, it was like we kicked it off right away. Like, I loved his office, and he has a track record for mentoring new doctors and helping them become more proficient as a clinician, and helping develop them into becoming business owners. And he offered me a job on the spot, which was amazing. So my fate was turning, and it was fantastic. And I accepted the job, which again was so beautiful. And the early bird catches the worm, because too often people are waiting until April, May, closer to graduation to look for a job. I started looking for a job as early as my junior year, and started doing interviews in the fall and interviewed in December. And I was able to land my dream job. So that's my best advice, is just start early, maintain relationships, and know what you want. And if you don't know what you want, shadow so you can figure out what you want. And so it was beautiful. It was so great, because it gave me that, knowing that I had a job lined up after graduation really gave me the motivation to finish all my requirements and graduate really proud, because I knew I had a future. So even though I grew up in New York, and actually, part of the reason I didn't want to go back to New York, even though I'm sure my family friend dentist would have hired me, was because if I wanted to practice in New York, I had to do one more year of, I had to do a post-grad year or a residency year, because that's the New York State requirement. So you have to check if you have a desire of working in any specific state, you need to know what is their specific state requirement to become licensed there. And I was really burnt out of school, because I had been in school my whole life. My then boyfriend, now husband, is a musician, and he was tired of school. We were ready to just start our life. And so I was like, you know what? I felt really prepared to graduate and start school. And so that's why I started looking for a job, and I landed my dream job, and we took a leap of faith and we moved to Las Vegas. And so here we are. There's my boyfriend turned husband, my dental school boyfriend turned husband. He's a musician. And we took a leap of faith. We moved to Las Vegas, where I worked as an associate for 1 year. And after working as an associate, with such great mentorship and such a great office where I was able to obtain such wonderful experience, because I saw so many patients and just got exposed to so many things. After 1 year of being an associate, Pacific Dental Services approached me about opening and partnering with them to open my own startup dental practice in Las Vegas. So it was really beautiful. And so there I am. At the grant on the left, there I am. I graduated dental school 2015. I worked as an associate, and July 2016, I started at my brand new office, which was scary, and that for sure is going to be its own own webinar on starting your own dental practice. But, you know, I became a doctor at 25 and I became a practice owner at 26. Like seriously, so beautiful, and could not have been possible without my partnership with Pacific Dental Services. And so I'm always very thankful for that. And so after 2 years of opening my dental practice, after I had already had an associate, and my first baby was walking, then we're going to flash back. And then I gave birth to Billy, my son, and I felt like it was an appropriate time to step away and focus on starting to build my family. So I always joke that my office is my first baby, because a startup or any business is a child. Like it requires blood, sweat, tears, sacrifice, and a lot of attention if you want it to thrive and grow. And I draw so many parallels to being a practice owner to being a parent, because it's so similar. Anyway, so my son is now almost 2 years old, which is wild. It's so nice to see him grow, but and I love it. I love the work-life balance, again, that my partnership with Pacific Dental Services has provided me, because PDS helps manage a lot of the behind-the-scenes stuff. You know, like they helped organize this for me, right? Like I have a very busy schedule, and they're like, "Hey, doc, can you do this day and time?" I'm like, "Great, on it." You know, and they help, you know, with my website. They help with, you know, payroll for my team. They help with, you know, making sure that I can get like medical benefits and 401k for all my team. So on the right is a picture of my team. I started back in 2016, one doctor, one front office, my office manager, and one dental assistant. And now I've grown my team. And this isn't even the most up-to-date picture. I don't think I have an up-to-date picture. We actually have, we're doing a team bonding this weekend, but like, I think there are like 19 of us right now. So really beautiful. I have 3 doctors, 3 associates that work with me. I have 8 dental assistants. I have 5 front office people and a partridge in a pear tree. Just kidding. But so it's really beautiful. It's so wonderful to see it grow. And I really think that, you know, at 26 years old, I didn't really have much of a business plan. And my business plan was just do whatever it takes and just make my patients happy. And it's nice to see that, you know, if you treat people right and you work hard, then you can grow this. So it was really, really beautiful. And this is my office. So talking about the beautiful offices that really attracted me to wanting to, you know, partner and join that, my dream job. Like one of the non-negotiables in my dream job was I really wanted to make sure that I worked in a modern office. And so here's my office, brand new, digital dentistry. We make crowns in a day. So that's what that machine in the middle, it's called a CAD CAM, computer aided design, computer aided milling. So we make crowns in a day. On the bottom left, actually, that is soon to be an old photo, because you know, and in a little bit we'll go over some cases and we'll see some x-rays that are just 2-dimensional, but I'm actually upgrading my x-ray unit. We're getting a cone beam scan, which is a 3D imaging, which is really important because patients, that way patients can better understand when something's 3-dimensional, and it's going to help me as a doctor be able to diagnose things better. So wow, that was a really long way to get to where I am today, but it's something that I feel like hopefully lots of little gems of like never give up, and just again, just tidbits on how to land your dream job and how to start your practice. So we're going to go on to our first case. And so as a general dentist, I'm the quarterback, okay? People are gonna come in and patients, I'm their primary care doctor, okay? And oftentimes people are just gonna be like, I want my teeth cleaned, right? I'm here for a checkup and cleaning. That's what patients come in for. And so this is a Panorex, and this gives you a nice overview of what's going on over here. And you're probably like, okay, I see teeth, what else is going on over here? But me as a trained dentist, automatically I see this tooth is missed. And if you see the L on the bottom right, that stands for left, okay? So when we look at these x-rays, we're viewing the patient as if they're staring at us, okay? So the L on the bottom right is because that's everything on the left-hand side. But automatically, I see this person's missing some teeth on the top right. I see that they have bone loss, and I see that they have some tartar buildup, okay? And we're gonna get to that. I'll show you that in just a moment. So I always like to do a Panorex because I always like to see an overview. And then this is what's called an FMX, okay? So this is a full mouth series. And so we do a bunch of, if you've gone to the dentist, you've seen this as well. And I always like to take pictures of our teeth because I like to be, you know, when I'm explaining to my patients, they don't know really what's going on in the mouth. And it's up to us as dentists, as a general dentist, to make sure that we're able to explain to them their conditions, okay? And dentists, if you don't already know, dentists have a bad rap, okay? Patients always say, like, I hate the dentist, and I'm like, nice to meet you as well. And patients will always say that, they're fearful of the dentist, they had bad experiences, or, dentists have a bad rap and they think, oh, that dentist is just trying to take my money, And when when I compile all the lists of why patients don't like coming to the dentist, I realize that a lot of it is rooted in, shows me that there's no trust between the doctor and the patient. And why is there no trust? And that also comes from a lack of understanding or a lack of partnership with the doctor and the patient. And so that's why I spend so much time, and this is something I really pride myself on, and I'm really passionate about, is that, we need to remember that patients don't know what clinical words and everything that we're talking to them is about. And honestly, that's how, when I'm giving this presentation to my pre-dental students right here, like, you didn't go to dental school, right? So you don't know what I'm talking about. And so a good dentist's job is to make sure that we're able to explain everything in a way that you understand, and then we need to find a way to create value in what we're recommending. Because at the end of the day, and this is something that I didn't realize until I became, started working as a dentist, because they don't teach you this in school, but you think that in dental school, the purpose of dental school is to teach you how to do procedures. But the things they don't teach you in dental school is like how to talk to patients and, like, ultimately, what is the job of the dentist? How are we going to even get to doing the procedure? So this is what I say to my new doctors, and I say all to my team members all the time, is like, doesn't matter if you know how to do all these crazy dental procedures. At the end of the day, you still need your patient to say yes and agree to do the dental procedure that you recommend, right? Like, because, I thought that if I tell a patient that they need an implant or they need a crown or they need this dental procedure, that the patient would do it, right? Makes sense, right? I'm telling you what to do. I'm the doctor. You should trust me. You're coming to see me, right? But you'd be surprised, again, with all the levels of distrust that comes with dentistry. And nowadays, patients are very savvy, right? With the internet, and they're Googling everything. They think they know. And so, patients are going to say no, or they're going to want to get a second opinion. And so we need to educate them. And so, and it's so important that we, I like to talk to patients in a way and show them that I care. Okay. So here we are. And that's why I like to use visuals. That's why I take intraoral photos. So you can see the pictures. That probably, to you as someone who doesn't have x-ray training, you're like, oh, I see all that tartar build up on his teeth, or I see, his teeth look a little, not clean. Okay. That's really self-explanatory. Okay. Versus some of the x-rays that are like, I don't know what that means. Anyway, so we're going to dive a little deeper. Okay, so this is called a Bitewing, and this is a really indicative x-ray because it tells me what's going on. Every patient who comes in, I like to say that not all cleanings are created equally, and there's a lot of misunderstanding when it comes to diagnosing cleanings. Patients come in and they're like, I just want to get my teeth cleaned, okay? And then there's another factor that comes into the complications of what patients actually do, and that's cost. Right. So again, I tell you, you need this work done, and you think patients are like, yeah, totally, I'm 100% on board, which is honestly, like, now for the most part, everyone's 100% on board. I've gotten to a point that I'm really good at gaining my patients' trust and explaining things to them. But then the reason they don't do dentistry is mostly because then they're like, well, what does my insurance cover? And again, dental insurance is actually not a real thing. There's no insurance. It's actually like a dental benefit plan that helps cover the cost of some procedures, but there's always going to be a copay. And so then patients are like, well, that's too expensive, right? So, this patient in this x-ray over here, what I'm seeing right now is this patient, like I said, has bone loss and tartar buildup. And so I'm going to show you exactly what I'm talking about. Okay. See everything that's circled in those red circles. Okay. They look like snowflake looking things that are sticking or attached to the teeth. That's called calculus. That's called tartar. Tartar is hardened plaque. Okay. And so my best analogy, and I tell my patients this, is that every time we eat, food gets left behind in our teeth, and our mouth naturally has bacteria that live in our mouth. Okay. And if you've ever thrown or left bread on the sidewalk and you see ants start, eating at the bread, right? That's like the bacteria, right? So the bacteria in our mouth are starting to feast on our leftovers. And then, you know, ever see that ant pile turn into like a really nasty ant pile because there's like ants on top of ants on top of ants on top of ants trying to get to that bread? That's exactly what happens in our mouth, okay? That's what plaque is. Plaque is a colonization of bacteria. And if left there over time, it hardens, okay? Have another really good analogy. And I love speaking in analogies because I think it's really important because it helps you visualize it, okay? In healthy gums, the gums are tightly attached to the teeth, okay? Think of it like my sleeve over here, okay? So in healthy gums, so this, my arm is your tooth and my sleeve is your gums, and your gums are a protective component, okay? And so in healthy gums, the gums are tightly attached to the teeth. But over time, as plaque, tartar, bacteria start to build up, your gums start to detach from the teeth, okay? And now more bacteria is able to spread and accumulate, all right, below the gum line, below where your toothbrush can reach. And that's what those red circles symbolize, okay? In healthy gums, the gums are tightly attached to the teeth. In healthy gums, the gums don't bleed. And there's a lot of factors that affect gum health, okay? There's a genetic component to it. There's, you know, if it's been a while since your last visit, if you have missing teeth, if you're taking certain medications. So there's a lot of factors that affect gum health and why maybe some people may accumulate tartar more than others, or why some people have more destruction of their gums and the bone more than others. But yeah, so like I said, over time, as this tartar starts to build up below the gum line, this gum starts to detach from the teeth, the gums start to recede, and actually that inflammation starts to spread to the bone, and it starts to eat away at the bone that is holding the gum, that's holding the teeth in place, right? The gums and the bone are what hold your teeth in place. So this is a serious condition. This is called periodontal disease. So periodontal disease is a gum infection or a mouth infection that eats away at the gums and the bone that hold your teeth in place. More than half of American adults have some form of gum disease. And this is the number one reason adults lose teeth. All right, it's because of this destruction. People think, oh, I'm getting older. That's why my teeth are loose. No, you're the reason that your teeth are becoming loose is because of periodontal disease. I've seen 100-year-olds without periodontal disease who have very firm, stable teeth. Okay, so anyway, so I like to draw these pictures for my patients. I'm like, see that? That's tartar, that's eat it. And I give them this whole explanation. And I tell them the appropriate treatment for this is called scaling and root planing. Patients call it a deep cleaning because you have those deep pockets, okay? And so I show them this picture and they're like, oh my God, that's my mouth. And they get really embarrassed, you know? And I'm like, no, don't be embarrassed. And that's why I try to remind them that they're, you know, because again, like embarrassment or fear, these emotions are what affect people from getting dental work done in the first place. And so I'm telling them, I'm here for you, okay? I'm your advocate, I'm your partner. I wanna help you get healthier, okay? So I show them this picture and I tell them, hey, myself or my hygienist will numb you so that you're comfortable. And we're gonna remove all of this tartar and bacteria that's stuck to your teeth, stuck below the gum line, all right? And, you know, and that's gonna allow the gums to shrink and reattach to the teeth tighter. All right, and this is an example of someone who doesn't have periodontal disease, okay? This is an example of someone who has healthy gums, right? So you see the difference, buildup, tartar, red gums, okay? Healthy, you know, and there is a little bit of tartar buildup in between the teeth, but nothing major. And again, this is just showing you the difference between someone who has healthy bone levels, okay? So what I'm looking at over here is like in between the teeth, all right? And this is going back to that previous slide. See the horizontal lines? The top line is where the bone used to be. The bottom line is where we are now, okay? So see how there's a lot more black in between the teeth? This is the person who has periodontal disease versus a person who has healthy bone. All right, so this, all the gray that's in between the teeth, that's nice, healthy bone versus here. See how there's a lot of black? See how the bone loss is mimicking or following where there is tartar buildup. Okay, so again, the tartar buildup is creating this inflammation that's causing bone loss and all that stuff. So this is something I spend so much time educating my patients on, because then when I tell them that they need periodontal scaling and root planing, that's the deep cleaning, they're like, okay, I'm on board, but then they find out that their insurance may not cover it, right? Or they have to pay a couple $100s out of pocket. And they're like, well, I only want to do what's covered by my insurance, or I only want to do what's free, or I don't have that money. And that's what's up to us, again, to create value. Like, and I see they have an iPhone. I see that they're wearing a Louis bag, or I see that they're driving, you know, some BMW outside, right? And I'm like, do you not have the money, or do you not think that this is important? And that's where it's really up to us, again, to create value and really, realize like what drives our patient, right? Because me saying that you're at risk of losing your teeth may not really resonate with a lot of patients. They might be like, okay, like they think that that's not them, right? They think they're immune to that because they're young, naive, whatever. But if you tell them, oh, well, this is contributing to your bad breath, or this is going to make your teeth, create gaps in between your teeth and make it look not cosmetic, you have to think what appeals to different patients. Or some people are like, well, this is going to affect your chewing, or like, oh, they're a foodie, so you need to think about like, get to know your patient and figure out what makes them tick. And that way you can create, help create value in the treatment based on what's important to them. And so if you don't already do so, I recommend that you follow me on Instagram. I create these oral health minute videos, and it was really inspired by my patients. And so this is just a really funny video related to periodontal disease.
Not all cleanings are created equally. Patients be like, I just want my regular cleaning. What my insurance cover? Pre-cleaning? Prophylaxis. A prophylaxis is for healthy gums without disease. It's like taking your car to the car wash when it's only 6 months old. Drive-through car wash will work just fine. See you in 6 months. If you have deep pockets, bone loss, and the dentist diagnoses you with periodontal disease, you need scaling and root planing. Why do I have a copay? A deep cleaning? Has it been a while since your last car wash? That drive-through car wash will not be enough. You need a detail. The dentist or the hygienist will clean off the plaque and tartar that are stuck in those deep pockets. Now that tartar is out of the picture, the gums and the teeth can reunite and be best friends again. But it doesn't stop there. If you want to keep your gums healthy, you'll still have to come in for your regular 3 to 6 month checkup. I'm Dr. Bianca Velayo, and I hope you enjoyed today's Oral Health Minute.
All right, so that's just a little fun. Anyway, so I'm going to switch gears just a little bit and just talk to you about something else that I'm really passionate about, which is facial injectables for dentists. And this is a really hot topic that patients really like, or students really like to know about, because they're, we hear a lot about it, but they don't know what it is. And so depending on the state that you practice in, dentists are allowed to administer Botox and fillers, okay? And so there are a couple different types of wrinkles. There are dynamic wrinkles, all right? So every time, if you look in a mirror, if you look in your camera right now, and if you make an angry face or you smile, and, if you make an angry face, see these wrinkles happening in between my eyebrows, or if I'm surprised, you can see these wrinkles happening in between my forehead, just like The Rock, just like Justin Bieber. So dynamic wrinkles are muscular in origin, okay? And they happen when you make emotions, and then the wrinkles go away as the emotion flees. But over time, through repetitive movement, aging, loss of collagen, these dynamic wrinkles can become static wrinkles, meaning that they're always present. So static wrinkles are always there, okay? So if you take a selfie and you're not making a face, but you see wrinkles, that's called a static wrinkle. But also the natural aging process is that gravity, eventually things start to sag. You have atrophy of the fat pads of your face. And, so just like Albert Einstein, he's not really making any face, but you can see all those wrinkles. So, static wrinkles may have a musculature origin, may have been previously a dynamic wrinkle, or it may just be, like I said, just due to the natural aging process. And as I mentioned, there are 2 types of main facial injectables that dentists can inject. Number 1 is Botox, which is Botox is a trade name, just like Invisalign is a trade name, just like Kleenex is a trade name. But Botox is actually botulinum toxin. And what botulinum toxin does is it causes a temporary paralysis of the muscle. Okay, so if the muscle cannot contract, if I'm not able to make this, if I can't contract this hard enough to make a wrinkle, then the idea is that your body's natural defenses will fill in those wrinkles, and then the skin becomes smooth, okay? But Botox only works on muscles. A common misconception I get all the time is like, you do Botox and you make my lips look like Kylie Jenner's. And I'm like, actually, Kylie Jenner didn't have Botox. Like lips don't, the lips don't get Botox. They actually have what's called dermal fillers, okay? So dermal fillers is basically an injectable implant, okay? And so anywhere that you've lost volume or anywhere you want to add volume, that's where dermal fillers work, okay? And so just like there are two types of wrinkles, dynamic, which are musculature in origin, and static, which are always present, there are two types of injectables, right? So the Botox works on the dynamic wrinkles, and then the fillers work on the static wrinkles, okay? Anyway, so in my practice, things that I treat and use Botox for, people who are suffering from TMJ, clenching, grinding. These are people who maybe we think about wearing a night guard and they don't wear a night guard, or they're not compliant wearing a night guard, or they grind holes in their night guard. And so we do Botox in their masseter muscle, which is the muscle of mastication. So for everyone, if you want to be part of this demo, you're going to take 2 fingers, you're going to put it to your jaw, and you're going to bite down all the way. And you're going to feel that muscle protrude, okay, right on your jaw over here. That's called your masseter muscle. And so I do an injection right over here on the outside directly into the masseter muscle. I compare it very similar to like getting a flu shot, right? It's an intramuscular injection. It doesn't really hurt. And then it causes a temporary paralysis of the muscles. And so it reduces the activity level of the muscle to that of a normal level. And so patients are no longer able to break their teeth when they're clenching and grinding. Yes, true stories, especially during COVID. People have been clenching so hard because they're so stressed they break their teeth. Anyway, and people who suffer from bruxism also get headaches. And so there's a lot of therapeutic components for Botox, but then also cosmetic, you know, if people don't like the wrinkles. So yeah, and gummy smile, which is interesting. So people who have excessive gingival display when they smile, we can do Botox to relax the lip. And so then they don't have it showing as much, also known as like a lip flip, if you've been hearing that on Instagram. Anyway, so I'm just going to show you. This is my husband. He is really fantastic. He's a trooper. So you can see each white dot represents where we're doing an injection. For my male patients, I call it Brotox, which is really fun. But yeah, like, so, you know, you can inject on the forehead for people who are suffering from migraine headaches. What's cool to know is that whether you're injecting for therapeutic purpose, like someone who's suffering from migraines, or whether you're injecting for cosmetic purposes, like, you know, you don't like your wrinkles, it's the same injection site. So it's actually dual benefit. One injection gives you both therapeutic and cosmetic benefits. So as you can see, really quick, really easy, really fun. And this is something patients really like to do. So anyway, just a little bit of intro on facial injectables. If you're ever interested, or as you get into dental school, or be on the lookout, I host a lot of introduction to facial injectables webinars for dental students. And so if you ever want to learn more, just let me know, and we'll see how we can get you to join one of those webinars on how we can implement it in practice. Anyway, so this is me and my 2 associates, and it's really been rewarding to see my journey come full circle, because I've been able to train my doctors, right? Like the girl on the left, Dr. Tang, she, I hired her as a new grad, and then Dr. LaCour, the one in the middle, I hired her after she finished her 1-year residency. And so it's been really cool to see, you know, me mentor them and train them. And now we're actually opening offices together. So I'm actually opening my 2nd office this May in Las Vegas as well. So lots of opportunities for growth. So again, I mean, please stay in touch, because you never know if our paths will cross in the future, because I'm always hiring, because I'm expanding my businesses and growing my practices, and it's just really a beautiful thing. So that's pretty much it. I'm going to open the floor for questions. And like I said, I mean, if you need anything, please follow me on social media.
Wow, thank you so much, Dr. Velayo, for that presentation. It was super fun and super informative. And now we're going to have Dia here, who's our helper facilitator. She's been monitoring the chat, and she's going to say some questions from the chat.
Yes. So our first question of the day is, what are some things you did to relieve stress?
What are some things that I did to relieve stress?
Yeah.
I always made exercise and fitness a very important part of my life. Like I told you, I played sports in college. In dental school, I always went to the gym. Yeah, the gym was my escape. So honestly, like, and I think it's really important. Like, you know, I feel like I knew so many classmates that are like, you know, get really stressed before exams, and they're like, I can't do anything. And I'm like, let's be real. Are you really studying 24 hours a day, or are you going to be on Facebook a couple hours a day? Like, I sometimes feel like structure really helps me, and I'm sure everyone, like, prioritize the time you have, you know? And like, it's good because like for me, it's about like mental clarity, you know? And like, sometimes you need to know when to step away and then to come back, you know? Sometimes you just get really overloaded and really burnt out. And I'm like, I'm going to go to the gym for an hour, I'm going to watch a movie or whatever, and then I'm going to come back to it. So yeah, I think working out and then always making time for friends and family, like, you know, that was important. Like, I remember we'd always have like exams where there was always an exam the day after is the Super Bowl. I'm like, but the Super Bowl. And I'm like, you know what? Like, we're going to go watch the Super Bowl for a couple hours. Let's hang out. And then we'll go back and hit studying afterwards, you know? And so I feel like it's always like balance. So you don't go too crazy.
Yes. Someone asked, if you don't mind, can you share your undergrad GPA and DAT score with us?
Sure. What are my undergrad? I'm going to stop sharing my screen. Okay, cool. My undergrad, okay, I don't really remember this too much. My undergrad GPA, okay, I graduated cum laude, so I definitely had like a 3.5. My science GPA, I think it was like around a 3.5 or something like that. And then my DAT, I want to say it was like an average 21, something like that.
Yeah.
Yeah,
Nice.
it was like, you know, and it was so funny because like I remember, you know, you'll know because you're pre-med and pre-dent, and like when you get to dental school, that same competitive nature doesn't like settle in. But I remember like at freshman year, everyone's like, so what was your DAT score? And I'm like, I know people scored higher than me, but I got, all you need to do is score good enough to get in. No one really cares. Like, clearly I don't remember because it didn't matter.
Yeah, no, that makes sense. Another question we have is, what is a good amount of dental schools that I should apply to after undergrad?
That's a really great question. And I think that it's totally a personal decision. Like for me, because I applied to a lot of schools. I applied to, I want to say like 6 to 8, you know. I know people who applied to way more, and I just felt like that's sort of wasteful because it gets very expensive. And then again, I met someone who just told me they're only applying to one school. And I was like, whoa, you're putting all your eggs in one basket. So I think it, you know, just like everyone has different like levels of comfort, and obviously people have different financial levels too, because like I said, the more you apply, but I would say a few, because it's always good to have options. But at the end of the day, you need to make sure that you go to a school that you apply to a school that you actually want to go to. Otherwise, if you're just applying to apply, then I think that's sort of a waste.
Yeah, for sure. The next question is, do you have recommendations on how to write your personal statement?
My recommendations on how to write a personal statement, I would say you have to be true to yourself. And you want to write something that's also interesting to read. So I would say make sure that there's like a thesis, like there's a commonality. Like I think just good writing in general, you know what I mean? Like I've read a lot of different personal statements and I'm like, where is this going? Like, you know, tip also is you do not need to highlight your resume. We can read your resume. Because I used to do admissions when I was in dental school. I would do like admissions and I did interviewing for the, you know, so we read your resume. Like your personal statement is your time to show us something and tell us something that we're not going to be able to read. And so it's good to tell a story, but you want to make sure it's cohesive. Again, back to good writing. Like if you're in one paragraph, you're talking about birds, and the next paragraph, you're talking about baseball, and then you're like there's no cohesiveness to it. And I'm just like, I'm lost and I have no idea what's going on. So I think just like good storytelling, you want to have a theme, a thesis, and like, you know, and then from there, you just like, you want to be interesting. I think it's really easy to be really generic, you know, and just be like, I want to be a dentist because I want to help people. I want to be a dentist because I want to help my hands. But I think the best thing you can do, or use my hands, best thing you can do is like share stories. You know what I mean? That's really powerful. Like what was a life-changing moment for you that made you want to become a dentist? Like what, you know what I mean? Walk us through the emotional aspect of it, and like everything that you were feeling, you know, and then that's going to, I think that'll resonate, you know?
Yeah, for sure. The next question is, how do you balance work and family life, especially as a mother?
It's hard, that's for sure. I think that, again, I mean, that's why I've been really thankful to be partnered with Pacific Dental Services, because as a business owner, like, I know other people who don't have the dental management support like I do. I mean, 24/7. I mean, you have to make sure everyone's payroll is entered properly. Like, especially when COVID hit, I was like freaking out how I'm going to pay everyone. Like, luckily I had someone else who was able to order me signage and, like, you know, make sure my website was updated to reflect all the new protocols that we're doing, whatever. So the partnership definitely helps because they're able to handle a lot of like administrative stuff and things that I need help with. I can just, you know, like delegate it to someone else who has more skill or expertise, so I can focus on just being on the clinical aspect of running my business and training my team, and doing my dentistry and taking care of my patients, like being the leader at my office. But like some of the behind the scenes stuff that we don't realize as like practice owners really take up a lot of time, they're able to do. So that helps. But I think that balancing everything, I mean, it's hard. Like, let's be real. It's really, really hard. But I think I'm thankful that I have a lot of support, you know? And I do have to draw boundaries for myself, because like I love working and I really feel like my patients and my team really need me, but then also I need to realize like my family needs me too. So it's about the balance. And so I've created my schedule to accommodate that. So I work like 4.5, 5 days a week, but like I have like different shifts. So like, for example, like on Tuesdays, I work 11 a.m. to 8 p.m. And people are like, oh my God, you work so late. But I'm like, no, I love it because like I have the whole morning with my family and like, you know, so that's hard. But I think the answer is just, you just do it, and you just need to be good with your time. I'm very strict with my schedule. I guess that's what it is. Like, and then I check in with all my people and I'm just like, hey, what do you need from me? And then, you know, my family's like, I need more of you. I'm like, okay, well, let's schedule it. Like, let me make sure that I schedule this day off. And I'm, you know, because on my days off, it always turns into like adding more things like, you know, meetings and whatnot. But I'm like, no, like this is a family day. So I think it's just knowing that you can't do it by yourself and like relying on your support team too.
Yeah, that makes sense. And then the next question is, how did you prepare for your interviews?
How did I prepare for my interviews? You know, I wrote down like mock questions, and I would just, I like role play. I know some people don't. My advice that I tell to everyone, I would write potential questions down, or, you know, there are forums like what questions they're going to ask. And then I would write down my answer to the question. And then I would read it out loud. So I would write basically a script for myself, and then I would read it out loud. And then I'm like, oh, that sounds weird when I say it out loud. And then I was able to fine tune my script, and that I do all of that before then I do my role play, because like, you know, my friends or my boyfriend or whoever would be like, yo, you're not prepared. Like, don't come for me for practice interview if you're not ready. And I'm like, you're right. And so at least that way I get to them and it's a little bit more fruitful.
Mm-hmm. The next question is, do general dentists do procedures like implants, root canals, and bridges, or are these procedures for endodontists and periodontists?
Great question. So the beauty about being a general dentist is you can do whatever your little heart desires. Okay. As long as you're comfortable doing it, you know? And so now, like, as general dentists, they have coined this term. It's almost like super dentist, because like general dentists do a little bit, like, can do anything. My caveat for that is that if you're going to delve into more complex procedures, from like a malpractice standpoint, you're going to be held to the same standard as a specialist. And so you need to just make sure that you're comfortable doing it. What's cool about, I have specialists who come to my office. I have an endodontist, I have a periodontist, and I have an oral surgeon that come to my office. And so it's great because I feel comfortable doing any case that I want, but like complicated patients or complex or complicated procedures, I can refer to them. But I do implants, I do root canals, like I said, I do Botox, you know, and so, but I've also done a lot of additional training to do that.
Awesome. And then the next question is, do you plan on specializing?
No. No, I thought about it when, you know, I mean, at this point I have multiple businesses and I've grown my family. Like, I don't want to go back to school, but also like I could not find a single specialty that really I felt like I can like be passionate about doing every day. Again, I just love the variety. And like for me as a general dentist, I realize my passion really comes from the relationships that I build with my patients, and really just being like I said, the quarterback, their point person for like, you know, they come in and they don't know what's going on. And I'm like, okay, well, this is the plan. This is what we're going to do. Like I'm their treatment coordinator, and then I can bring in specialists. So I really like that aspect of it for sure.
The next question is, can general dentists do braces too, or is that something orthodontists do?
Again, I mean, I know some general dentists who do. I do Invisalign at my practice, but again, like if you have, it's your own comfort level, but yeah, I mean, I don't do metal braces, I just do Invisalign, which is great. And if not, then I just refer to the orthodontist.
Gotcha. And then we have 2 more questions. How did you deal with dental school loans, if you had any, and how were you financially able to open your own practice so early?
Great question. So I get this question a lot about finances. And I have lots of student loan debt. I had undergrad. I had to take out a couple small loans to go to college. I was thankful that I had some grants to go to school. But then in dental school, there's no scholarship for me, you know. And so I took on the full student loan debt. Like I said, I'm first person in my family to become a dentist. I had to navigate all this by myself. And we didn't come from money. So I took out all the student loan debt. And then, yes, you know, people are like, how did you open a practice so much soon? I had another loan, you know? And so that was one thing I really liked about being partnered with PDS as well, is that they have relationships with banks. So they were able to get me approved for the practice loan. I'm really proud to say that I've built up enough equity in my business, and I have enough money saved that if I sold my practice, I have enough money to wipe out all my debts, but I'm not going to. So that's cool. But to me, and this is my advice, is that I view the student loan as a means to the end, right? You know, it's an investment, okay? Yes, it's a very expensive investment, but if I were, you know, people could take, you're right, people are like, oh, I can take that $500,000 and put it in the stock market. Okay, but that's a gamble, right? Or I can take it, and I live in Las Vegas, let's go to Bellagio, whatever. That's a gamble. For me, I trusted myself, my skills, my ambition, my hard work. And I was like, I'm investing in myself and I'm doing this. And guess what? It paid off. So don't be afraid to take on that debt. If you're willing to work hard and you have a plan, okay? My plan was, I'm going to open a practice. I'm opening multiple practices. I'm working my tail off. I work a lot of days. I'm making sure that I'm making an income that can pay everything off. And so when I graduated dental school, I was on, and I still am on, an income-based repayment program. Again, so this is not for everyone, but this is my whole philosophy, and everyone has different philosophies. So I think it's important that you figure out what you're comfortable with. But the reason I did an income-based repayment program is the whole idea behind the income-based repayment program is that you're only paying a certain percentage of your gross monthly income every month towards paying off your student loan debt. I think it's 5%. And so your first year, you're paying like not a lot of money because you didn't have an income previously. And as you make more money each year, then you're expected to pay more. And for me, I was like, well, you know, I don't have, you know, because if you don't do an income-based repayment plan, my monthly student loan would have been like $5,000-$6,000 a month. And when that's a lot of money versus like a couple $100 a month, or like $1,000 a month. And, I figured I could use the remaining $4,000, $5,000 to, for my rent, for, living my life, to go out to dinner, because again, talking about that balance, like I need to have sanity. Like I work really hard and I need to make sure I had something to reward myself with, a vacation here and there, and so again, people are like, well, you're accumulating more interest. You're just, it's going to pay off, blah, blah, blah. But I'm like, to me, the dollar to me now is more worth while than $1 to me in the future. Like, I know I'm going to grow my net worth. I know I'm going to make more money eventually. And like the moves that I make now are going to help me make sure that I can pay that in the future. But like, you know, I use that extra money that I'm not paying on the standard student loan so that I can start my Instagram, so that I can, you know, invest in like more marketing for myself or like whatever. And, you know, so that's my whole theory. Again, everyone's different, but you just have to ask yourself, like, are you willing to put in the work? And if you are, then I think it's a good investment. Long-winded, but something I'm very passionate about.
Yeah, for sure. No, it's a different take on it, which I really like appreciate hearing about, because a lot of people don't sway away from like not investing so much in the beginning, but it's cool to see like someone be so successful from doing that and following your dream. So
thank you. Well, you know, for me, like I was thinking, I mean, why am I going to wait 5 years to open an office? Like what, you know, I mean, I need to start, you know, I need to start my life now, you know? And like I said, I mean, I took the investment and it's paying off. So for sure.
Yeah,
thank you.
For sure. That's exciting. And so the last question is going to be, what was the most challenging aspect for dental school?
What was the most challenging aspect of dental school?
Mm-hmm.
I mean, I think for me, and it's going to be different for everyone, but I think it's like the volume. But, you know, the first 2 years really kick you in the butt, because it's like I said, you're taking like 11 tests in a couple days, no sleep. It's like you're cramming so much knowledge that like, whoa, you know? So it's just the stress of passing the exams. Because, you know, like for me, I just, again, view dental school as a means to an end. Like I need to go through this so then I can become a dentist and I can start practicing. I really liked clinic. That's where I really excelled, because I really value relationships with my patients. Like I liked like the problem solving, because like treatment planning is a lot about problem solving, right? But you know, all the classes and just like, oh my God, am I going to pass? And like all that stuff and your boards and stuff like that. Like, it's just such a high stress